you ever Googled something in the middle of the night? Perhaps your child had a fever and you were looking for some advice. Or maybe you've been searching online for some tips about helping your child sleep or dealing with fussy eating. Or perhaps your teenager has been caught in a scrolling surge on TikTok and is following advice about acne and their skin. These things are all really common. With health information online today, it can be hard to know what's actually true and what's untrue. I'm Dr Anthea Rhodes, Paediatrician here at the Royal Children's Hospital and your host today on the Kids Health Info podcast. And joining me to talk about mis and disinformation and give us some tips on how to navigate this space is Dr Alex Cussen, a consultant with the Adolescent Unit here at the Children's Hospital. Welcome, Alex.
Thanks for having me.
Health information is online, absolutely. Is that a bad thing?
I think that's a really good question because there is so much health information online and that's something that's really changed, over many years. I don't think it's necessarily a bad thing, and I think health information online, it can be a really positive way of learning a little bit more, potentially also allaying some fears. If you just want to have a quick look at something and work out, should I be worried about this? Should I go and speak to someone about it? It can be a really great way to get basic information about lots of different health conditions. And it's kind of everywhere. You can search online, but it's also on social media. There's all sorts of places you can find this information, and it can be a little bit hard to tell what's true and what's not, and sort out the good information from the bad information, I guess.
And so with young people, teenagers perhaps that you see in practice, do you find they are looking for information online?
Absolutely. And I think it's actually something we expect now as doctors. We just know that that's part of day-to-day life nowadays. People will generally look something up online before they come in to see their doctor. And so that's really something that's happening all the time.
Because sometimes I think parents and young people feel a bit embarrassed, or they feel like maybe they're not supposed to tell the doctor that they've Googled this first, or that they've seen something on TikTok and decided to give it a try. So if parents are feeling a bit wary about that, what would you say?
I'd say I'd absolutely encourage you to let us know if you're coming in for an appointment, especially if you've Googled something or seen something online and it's worrying you. We'd actually prefer to know, and we can have a chat about it and really just sort through, is what you've seen true? Is it relevant to you or to your child? And we can have a little bit of more of a talk about it.
I definitely have parents show me things. I say, what are you looking at? Show me the site. Yeah. And then we can sort of talk about it together. Gone are the days where we say you must never Google anything.
Yeah,
we expect people to come with information, yeah?
Yeah, we definitely used to say that. We used to say, don't Google, just ask your doctor for advice. I think those days are over. We're really in a world now where we really expect it.
Sometimes, though, that information can be perhaps untrustworthy or misleading. Have you come across that with any of your patients?
I've definitely seen, young people who, for example, have followed dietary advice that they've seen online. They've cut out food groups from their diet, or they've started themselves on supplements because of a video they've seen, that it might help their symptoms of, feeling tired or muscle pains. I think there can be a couple of problems with that. It's not necessarily a problem if you're not doing something that's dangerous, but at the same time, one thing is that it can be a bit of a waste of time and money if it's something that doesn't really work. And the other thing is that if you haven't seen a doctor for that health condition, you might not actually be getting the treatment that you need. And so if you just kind of started a remedy at home yourself and you're not actually looking into why you have those symptoms, that can become a bit of a problem too.
I know I've seen parents with young children perhaps are having difficulties with sleep or difficulties with diet, and they've tried things and that has meant they haven't actually got to the bottom of the problem that they might have got an answer to if they'd seen a healthcare provider. More and more we're hearing these terms mis and disinformation, particularly in relation to health. Can you tell us a bit about that?
Yeah, absolutely. So misinformation is where you've got health information or any kind of information really that's false or not true, but that's not done on purpose. So the person who's sharing that information doesn't really necessarily know that it's false. So I guess a good example of that in health information would be if you see a post online that says if you have a fever, it means you have a really serious infection. So that might be someone really trying to help and trying to share health information, but at the same time they might not realise that that's not always true, and also that it can cause panic and unnecessary worry in the person who sees that post. Whereas disinformation is health information that's false also, but where the person is doing that on purpose. So it's intentionally shared, with the intent of sharing this sort of false information. So I guess an example of that would be when someone's promising a miracle cure for a condition that we know can't be cured. And it's really unfortunate that exists, but it is quite common. It's not new either. It's been around for hundreds of years that people promise miracle cures, but also can cause quite a lot of harm.
I think you're absolutely right about miracle cures, Alex. I can think of an example of a young person that I was seeing in clinic who was having trouble with their skin, had acne, and they had been purchasing a product online, which subsequently we learnt when we did a bit of investigation that the person selling that was aware that it actually would make the problem worse. And so part of the strategy was that they would say to this young person through the marketing, at first it will get worse, that's the product doing its job. It just means you need to also buy this second product that will actually then help deal with that problem. And so increasingly through deliberately misleading someone, they were selling multiple things and actually creating really quite a significant health problem in terms of this person's skin. So we, in the end, had a really distressed young person who had spent a lot of their own money, had not shared this information with their parents because they were embarrassed. And, it took quite a bit of work to get back and unpack all of that and, give them a treatment that worked and actually improve things. But they had really been led astray, and that had been done very intentionally.
I think on the flip side, I've got an example of a young person who found out about skin treatments online, and that actually made them come and seek help for their skin. They were a young person who had really quite severe acne and really hadn't had any information about it. So hadn't seen a doctor, hadn't spoken to their parents about it, probably because they were embarrassed, similar to your young person, but didn't know that there's actually really good treatments available. And when they started to look online, actually saw that there were treatments available. I thought that was a really, positive experience, actually.
Yeah, absolutely. Information is positive if it's used in the right way.
Exactly.
So thinking about how you do actually work out what's trustworthy and what's not, what sort of tips have you got for families and also for teenagers who are increasingly online themselves looking for health information to help you make a decision about what is good advice?
I think one thing you can do is start by looking at sources of information that are trustworthy, and by that I usually mean a couple of different things. Things that are written by health professionals or, health organisations, so like children's hospitals, and things that are endorsed by the government, for example, are usually more trustworthy. So you could go to those sources first. But I think it's also, important to know that you'll probably see health information popping up where you're not actually necessarily choosing what you're looking at. So there's probably some things you can look for to work out whether it's a source that you can trust. One thing is, can you figure out who wrote this information? Often if it's written by, a credible endorsed source, it will say so. So there'll be either a logo or the name of the health professional. If you can't find that, it's a bit of a red flag. It might not be something that you should listen to. I guess the other things are looking at the language that's used. If it's really emotional, sensational kind of language, I'd be a bit cautious. And if it's promising things that seem too good to be true, so promising miracle cures or things that really contradict with something you've heard from your doctor, I'd be a bit cautious about that too.
And so with websites, it can be perhaps a bit easier to look for some of those things and obviously, cross-check, Google, see if there's another source that's saying a similar sort of thing. What about if you're on social media? So we know particularly for young people, but also adults, as well, and parents, increasingly health information is just served to you. You might not even be looking for it or even realise that that's what you're actually consuming. It might look like wellbeing information or just things about being healthy or your lifestyle. But in fact, there's health messages in that, and sometimes people are actually taking action based on what they see. What advice have you got there?
Well, you said, Anthea, about cross-checking. You can still do that from social media. So if you see some information you're thinking, maybe I'll try this, you can still cross-check. So you can Google the person who is giving you that information and see what qualifications they have. Do they have any, way of being trustworthy in giving that information? I think also, you're right, it's really hard to tell if it's health information or not. But I think if you're about to start trying a major change, if you're about to go out and buy a supplement or an over-the-counter medicine, or if you're about to change your diet dramatically, just stop and have a think, really that kind of questioning mind, and think, well, why am I doing this? Is it that this person on social media is trying to get me to buy something? Or, maybe just click on their posts more and think about why you're doing it. Think about fact-checking that either by searching or by asking a health professional.
Yeah, I think that idea that if something's being sold to you, that's a big red flag, isn't it, as to what the actual motivation for that information is.
Absolutely.
And what about AI? So this has really emerged in a big way, particularly in the last 6 to 12 months in health. And frequently now, if people are Google searching a topic, you don't even go to the website, you just get that AI summary up top.
It's sort of crept in, hasn't it? It's kind of everywhere. And I think just like health information being online, it's probably going to be a part of our lives, ongoing. It's going to be there. One of the key things is being aware of it. So again, you can cross-check. So I know a lot of people now aren't even Google searching. They're tapping their question into AI and just getting the answer back. You can't always tell where that answer has come from. It's an answer that's, often generated from many different sources. So you can go and check on a reliable website, or check with your health professional about whether what you've read is true. I think another way that AI is starting to be used is in symptom checkers. So you can actually sort of interact online talking about your symptoms. Just like seeing a doctor in person is always going to be sort of better in terms of being able to see you physically and listen to you. We just know that those symptom checkers, they might be good for a little screening tool to say, well, do I need to worry about this, or do I need to go and see someone? But it might not be the best way to get definitive health information.
Yeah, great. And obviously for good reasons, those things are available all the time, and they're anonymous, and they're obviously really appealing when it comes to health issues. But as you say, it's really that first step perhaps to get a bit of information, and from there taking that with you to actually talk about it with a trusted healthcare provider is really going to make sure you're not led astray. Excellent. So some top tips then for families at home, red flags of things to look out for. What advice would you give?
The first top tip really is not to be too worried or ashamed that you're looking online. We know that it can be a great source of information. Don't be afraid to talk to your health provider if you've found something online and you're wondering about it. I think the other top tips would be just to question what you see. Really think about it and think, do I need to check this? Do I need to check this somewhere else? And think about where that information's coming from. So thinking about reliable sources. Do I need to look on a government website or a hospital website to check this?
And of course, at the Royal Children's Hospital, we've got Kids Health Info, and we're just launching Teen Health Info. So a huge suite of online resources that are trustworthy. So we always remind parents to make sure they know how to find that, and that can be one of their sources when they're looking for that information when they need it.
Absolutely.
So for parents and young people listening, we'll provide links to those resources we've talked about today in the show notes. Thanks again for coming in, Alex. It's been a really great chat.
Thanks so much for having me.
Information in this podcast is general in nature and is intended to support, not replace, discussions with your doctor or healthcare professional. If you have concerns about your child, please consult your local healthcare professional for individual advice. This podcast is recorded on the traditional lands of the Wurundjeri people of the Kulin Nation, and we pay respects to their elders. Kids Health Info is funded thanks to the support of the Royal Children's Hospital Good Friday Appeal.